Good afternoon. I'd like to welcome all of you to the Outdoor Art Club webinar, Dementia or Alzheimer's, Advice and Support for Caregivers. I'm Robin Geisler, and I'm working with Lois Ashley to bring you today's program. The Outdoor Art Club is a women's organization that focuses on civic and charitable work in the Bay Area. The club runs a public speaker series every year, and this webinar is the 10th in this year's series. Recent topics have been as varied as caring for wildlife in Northern California, finding art in our oceans, and then today's program, which will offer advice to caregivers who are dealing with dementia and Alzheimer's. Before I wrap up, I have one housekeeping item to pass on. We're saving the last 15 minutes of today's program for a question and answer session. Both of our speakers look forward to answering your questions, so please send them using the Q&A function, which should be at the bottom of your Zoom screen. And thank you again for joining us. It's now time for me to introduce Joanne Zavlaris, who is the program chair for today's event. Welcome, Joanne. I think you're going to come on screen in a second, and thank you for bringing us this incredibly helpful program.
Thank you, Robin, and thank you, Lois, who I know is back there in support of Robin. It is a great pleasure to be here today, and hello to everyone out there on this lovely, beautiful summer day that we're enjoying. I'm very pleased to introduce and welcome to our club Jean Girimonte and Lauren Hibdon. They're both from the Alzheimer's Association. They will be speaking to us about their insights, knowledge, and personal experiences with Alzheimer's. We've had a couple of meet and greet meetings, and I just can't wait for you to meet them and let them tell you a little bit about themselves. So without too much further ado, I'd like for you all to greet Lauren and Jean.
Hello, thank you, Joanne, for the introduction, and thank you to the Outdoor Art Club for inviting us to speak today. My name is Lauren Hibdon. I am the Family Services Manager for the Alzheimer's Association in the North Bay, and I've worked for the association almost 10 years now, supporting families and those with the diagnosis of Alzheimer's or any form of dementia. And I work really closely with our volunteer community educators, and I've brought with me today one of the best out there, Jean Girimonte. So, Jean.
Thank you, Lauren and Robin and Joanne. Thank you, and all of you attending. It's good to have you with us. Again, my name is Jean Girimonte. I'm joining you from my home in Santa Rosa, and I am currently a volunteer community educator with the Alzheimer's Association. I've been doing this for the past 2 to 3 years. And I'm also a board member on the Northern California and Northern Nevada chapter of the association. So I'm pleased to be with you. My connection to the Alzheimer's disease is that I was a primary caregiver for my late husband, Art, who lived with Alzheimer's for a period of 7 years, and he passed away in 2018. So I'll share a few of my experiences through the course of today's program. And we'll get going on that in a few seconds. I just wanted to ask everybody attending if you're comfortable putting your first and last name and zip code in the chat box. It would be very helpful to the association in that when we apply for grants and various funding opportunities, we need to demonstrate that we've actually delivered these programs to a wide audience. So only if you're comfortable, if you wouldn't mind, we'd be appreciative if you do that. So again, thank you for attending. Today, I'm going to share my screen now to get my slides up and ready to go here. Give me a second to,
what we now call the formation of plaques and tangles.
Get the lead slide here. Okay. So today's program is titled Understanding Alzheimer's and Dementia, and this is produced and presented by the Alzheimer's Association. It is designed for those interested in learning more about Alzheimer's and other dementias, and it will feature information from dementia experts, and perspectives from individuals living with dementia and their care partners. A care partner is a term that many prefer over caregiver, while the individual with Alzheimer's is in the early stage, when he or she may not need much assistance with daily tasks, but still benefits from the support of family and friends. So let's take a look at what we're going to learn today and what you'll know by the end of the program. And that is to compare the terms Alzheimer's and dementia. We'll also look at how the disease affects the brain. We will identify the risk factors for developing Alzheimer's disease. We'll talk about the 3 stages of Alzheimer's disease. We'll identify the current FDA-approved treatments. We'll talk about the research that's going on, the scientific advances that are being made, and we'll conclude with some brief discussion about the resources available through the Alzheimer's Association. And so, let me get one more slide up here. So we'll get started here. You may hear the terms Alzheimer's and dementia used interchangeably. Now they are related, but they're also different. In this next section, we're going to discuss both Alzheimer's and dementia and how they're related. But before we begin, let's take just a quick moment to test your knowledge about Alzheimer's disease. And this is a true-false question, and you feel free to enter your answer into the chat box if you'd like, and I'll give you a few seconds to do that, and then I'll reveal the correct answer. So the statement is, Alzheimer's is a normal part of the aging process. Do you think that's true or false? And again, I'll give you a few seconds here. We'll see if you want to enter what you think is the correct answer. Getting any responses there?
Looks like people are saying false, Jean.
False? Well, that's actually the correct answer. Oop, I got too clicky here. It is a false statement. Alzheimer's is more than memory loss. It's a progressive and fatal disease that kills nerve cells and tissue in the brain, affecting an individual's ability to remember, think, plan, and ultimately function. Let's try one more question. Again, a true-false statement here. People younger than 65 can develop Alzheimer's. What do you think about that? True or false?
You've got a really well-educated audience. You've got a lot of truths. I haven't seen a false yet. Yeah.
Good. I like an educated audience. Makes my job easier. While most individuals living with the disease are older adults, people younger than 65 can also develop Alzheimer's. This form of the disease is known as younger onset Alzheimer's, also sometimes called early onset. In some cases, people develop the disease in their 40s or 50s. Now we're going to watch a video of one of our experts, Dr. Heather Snyder, who will explain how Alzheimer's and dementia are related.
Dementia is the umbrella term for an individual's changes in memory, thinking, or reasoning. There are many possible causes of dementia, and Alzheimer's is the most common cause. Other causes of dementia are vascular dementia, which is marked by changes in the blood flow in the blood vessels in the brain. Dementia with Lewy bodies, identified by specific brain changes throughout the brain that include the buildup of a protein known as alpha-synuclein. And frontal temporal dementia, which is marked by brain cell loss in the front sections of the brain or the frontal lobe. Each type of dementia may have distinct characteristics to cause specific behaviors in the individual, but there is also some overlap in behaviors among the types of dementia.
Get that bigger screen. Whoop. I want to get rid of this header up here if you don't mind, but I'll worry about that later. So on this slide, you're seeing the various diagnoses or diseases that are under that umbrella of dementia. So again, dementia being the umbrella term for many different diseases, and Alzheimer's being the most common type. We won't go into each of those, but you may recognize some of those diseases that are listed there. So now we're going to talk about what's going on inside the brain. As discussed, Alzheimer's is a brain disease. The brain is our most complex organ. It's also our most powerful, despite weighing only about 3 pounds. Again, let's hear from one of our experts, Dr. Maria Carrillo, about how Alzheimer's affects the brain.
More than 100 years ago, Dr. Alzheimer described specific changes in the brain, what we now call the formation of plaques and tangles. Alzheimer's is a progressive brain disease that's marked by these key changes and impacts memory, thinking, and behavior. The brain has 3 main parts: the cerebrum, the cerebellum, and the brainstem. Each one plays a role in how the body functions. Alzheimer's disease causes nerve cells to die, which leads to brain tissue loss and causes loss of function and communication between cells. These changes can cause the symptoms of Alzheimer's, such as memory loss, behavioral issues, problems with thinking, planning, and at the end stage, swallowing.
So we'll talk about the risk factors here. Everyone with a brain is at risk of developing Alzheimer's disease. There are a few known factors that increase a person's risk of developing Alzheimer's disease. Again, we're going to see what you might know about this. Let's see if you know which one is the most common risk factor that is. So on this slide, there we go. Here we are. Which of these options do you think is the greatest risk factor for Alzheimer's disease? Genetics, family history, or age? I'll let you take a few seconds to enter some answers. Are we getting a few responses there?
Yeah, I'm seeing kind of a mix between genetics and family history. I've seen one person say age, 2 people say age so far, but mostly kind of a mix of genetics and family history.
Well, in a sense, then you're all correct. While age is the greatest known factor, all of these are known risk factors. After age 65, the risk of developing Alzheimer's doubles every 5 years. 34% of people age 85 and older are living with the disease. And now we'll hear again from one of our experts as she explains the most common risk factors.
Alzheimer's disease is marked by specific brain changes that result in the clinical changes in individual experiences. That is, changes in memory, thinking, or reasoning. And ultimately, Alzheimer's is fatal. The exact cause for these changes is unknown, but there are some hints as to what may contribute to an individual's risk. Age is the greatest known risk factor for Alzheimer's. And when we look at populations of people, we see an increased risk over the age of 65. However, Alzheimer's is not normal aging. Family history is also a known risk factor. Research has shown that those who have a parent or a sibling with Alzheimer's are more likely to develop the disease. and that risk increases if more than one family member has Alzheimer's. When we talk about the genes involved in Alzheimer's, there are two categories that could potentially be involved: risk genes and deterministic genes. Risk genes increases an individual's risk for developing the disease, but does not guarantee that they will develop Alzheimer's. Deterministic genes, which are rare for Alzheimer's, guarantee that the person will develop the disease.
So I'd like to reiterate that although Alzheimer's is not a normal part of aging, age is still the greatest known risk factor. Let's take a look at some populations who are at a higher risk for developing the disease. In addition to the main risk factors for the general population, Hispanics, African Americans, and women are at a higher risk for Alzheimer's. Research has shown that older Hispanics are about 1.5 times as likely as older whites to develop Alzheimer's and other dementias, while older African Americans are about twice as likely to develop the disease as older whites. The reason for these differences is not well understood, but researchers believe that higher rates of vascular disease in these groups may also put them at greater risk for developing Alzheimer's. The reason that they believe about the vascular disease is because we know how closely connected a healthy vascular system and a heart are contributing to the health of the brain itself. Now, women are more likely than men to develop the disease. An estimated 3.8 million American women are living with the disease today. We know that women live longer than men, making them more likely to develop Alzheimer's. However, longevity and lower death rates can only partially explain the difference. Researchers are exploring how genetic differences between men and women may impact disease risk. And now, we'll talk about the stages here, but no two individuals experience the symptoms and progression of Alzheimer's disease in the same way. Let's hear from a few individuals who are describing what it's like to live with dementia.
It's a different kind of forgetting. It really, really is. It's not just forgetting where I put my car keys. It's much deeper than that. And for example, I cannot read a book. I used to be a voracious reader because by the time I turn a page, I have forgotten what I had read. And if you're reading a novel, you have to know what transpired before in order for you to continue to read on. And so I can't read a novel, so I've even stopped trying.
You know, I can really relate to what she just said, because that was one of the very first signs that something was changing with my late husband. He was retired before he developed the disease, and he was a voracious reader throughout his life. He always had at least 2 or 3 books on his table with bookmarks in various stages. And there was one particular book that I noticed he wasn't making progress. And I knew that he was really interested in that book because we had gone to a book signing with the author. And when I queried him, how he was coming along with that book, he said, I keep forgetting what I'm reading the page before. I'm very frustrated. I have to keep going backward in the book to remember things. And that really was one of the triggers to say we need to look further into this, and ultimately did lead to his diagnosis. Let's hear one more.
Math, I can't do a simple tip anymore. I sit there, I stare at it. It's crazy what numbers I can't deal with anymore. And in some ways, that's the disease to me. The other thing that I've increasingly been struggling with are words, which I've dealt with words my entire life, you know, as an avid reader, as a reporter, as a writer. I struggle with them now.
Again, the individuals we just heard from are living in the early stage of the disease. Symptoms worsen over time for everyone. However, people progress through stages of Alzheimer's at different rates as their abilities change. On average, a person with Alzheimer's lives 4 to 8 years after diagnosis, but can live as long as 20 years, depending on other factors. And now we're going to look at what we call the progression or the continuum of Alzheimer's disease. The progression of Alzheimer's disease from brain changes that are unnoticeable to the person to brain changes that cause problems with memory and eventually physical disability is called the Alzheimer's disease continuum. On this continuum, there are 3 broad phases shown on this slide in teal, orange, and purple. The first phase is called asymptomatic. In this phase, there may be changes in the brain long before a person begins to have symptoms or gets a diagnosis. As the disease progresses, the person will begin to experience mild symptoms, but will still be able to independently perform most activities of everyday living. In this phase, the person may be diagnosed with mild cognitive impairment, or MCI for short. In the graphic shown on this slide, MCI is an early stage of Alzheimer's disease, meaning that hallmark changes in the brain, such as amyloid buildup, are present. MCI can develop for multiple reasons, and individuals living with MCI may go on to develop dementia due to Alzheimer's, while others will not. In the third phase, people who do develop dementia due to Alzheimer's will experience more serious changes in memory, thinking, and behavior. This phase is further broken down into stages called mild, moderate, and severe, also sometimes referred to as early, middle, and late. Now, these stages reflect the degree to which symptoms interfere with the person's everyday activities. It's very important to understand that the stages of Alzheimer's are general, and because each person living with the disease has a unique experience, we can't always neatly place an individual into one specific stage. In fact, some people may exhibit symptoms that overlap stages. However, the stages do allow you to gain a general understanding of the progression of the disease. As Alzheimer's progresses, the individual's behaviors will change, as does the role of a caregiver. These stages can help caregivers prepare for what to expect and understand how to best respond. So now we'll talk about the FDA, Food and Drug Administration, approved treatments. Until now, the only treatments available helped with some cognitive symptoms of Alzheimer's. However, they do not modify or slow the disease. The treatments that may help to address symptoms of Alzheimer's include Aricept, the generic name of which is donepezil, Exelon, and the generic for that you may have heard is rivastigmine, Razidine, known generically as galantamine, galantamine, and then there's Namenda, which is the generic memantine, and finally Namzaric, which is a combination of donepezil and memantine. Now we have a new aducanumab, which is marketed as Aduhelm, And that was granted accelerated approval by the FDA just last year on June 7th, 2021. Aducanumab is the first treatment, I'll say this again, it is the first treatment that addresses the underlying biology of Alzheimer's disease. The other drugs we just mentioned, again, treat the symptoms, but not the underlying biology. And that's what's different about this aducanumab. Now, because everyone experiences Alzheimer's differently, these treatments work in varying degrees and are not effective for everyone. We encourage people who are interested in learning more about treatments for themselves, a family member, or a friend to have a conversation with their healthcare provider. Oops, went too far there again, sorry about that. So I just want to reiterate those 2 points on this slide, that it's good to have that conversation with your care provider before you have a full understanding of how these treatments may work. So let's move on to our topic of Alzheimer's research. In the last decade, researchers have made enormous strides in understanding how Alzheimer's disease affects the brain. Many recent insights point toward promising new strategies for treatment, prevention, and diagnosis. Let's hear a little bit about the hopefulness here.
This is an incredibly exciting time in Alzheimer's and dementia research. The advancements that we've made in the last decade to understand the disease as a continuum, meaning that the biological changes are starting a decade or more before someone is experiencing the changes in the memory and thinking. This sets the stage for possible prevention. The idea that when we have the tools to identify those individuals at the earliest time point, and when we have the interventions to target individuals at that earliest time point, we can intervene to stop or slow the progression of the disease before an individual loses their memories.
Growing evidence indicates that people can reduce their risk of cognitive decline by adopting key lifestyle habits. More and more research shows that factors like exercise, nutrition, and aggressive management of cardiovascular risk factors may impact our ability to slow cognitive decline as we age. And through current studies, we're exploring how certain lifestyle factors may even reduce the risk of developing Alzheimer's and dementia.
So it's especially critical that people of diverse races and ethnicities participate in clinical research. Because they are at an increased risk of developing the disease, it's important that researchers are able to study large populations of these individuals to better understand the disease and their elevated vulnerability. Let's take a look at an association service that can help people find these studies.
By participating in clinical research, you can move us toward methods of treatment and prevention for all those affected by this devastating disease. Alzheimer's Association Trial Match is a free clinical studies matching service for those with dementia, caregivers, and healthy volunteers. To start, simply create a confidential user profile and receive a list of studies that may be a match for you. Don't just hope for a cure, help us find one.
So let's talk now about what's available to you and the resources at the Alzheimer's Association itself. The association is available there. Excuse me, get one more slide up here. The association is available wherever and whenever you need reliable information and support. 3 of our key resources that can connect you to information and support are listed on this slide and include, first of all, our free 24/7 helpline. You can call us at 800-272-3900 anytime, day or night, to receive information and support. This provides access to highly trained and knowledgeable staff who can help with education, decision-making support, crisis assistance, and resource identification. Master's level clinicians are available around the clock to provide in-depth care consultations, which is a free of charge care navigation service offered to families at any stage of the disease. And this help is available in more than 200 languages through translation services. And I just want to remind you, this is not like a typical call center. This is truly a very helpful line. That's why we call it the helpline. It's staffed with qualified individuals who can address all of your needs and concerns. Let's listen to Tim as he describes his use of this line.
I've had a couple of phone calls that I've been able to make in to the call center when I've had a couple of quick questions that I wanted to ask. You know, there's been a couple of nights, 2 o'clock in the morning, you have questions, you have anxieties, and I was struggling dealing with them, and it's amazing. It was one of the best things I ever did, was keeping the call center on my favorites now. Just to know that there's somebody you can call who is aware of what you're going through.
I very much identify with Tim because I used that helpline many times. And as he said, there were times I had to use it in the middle of the morning when I would wake up with a lot of anxiety about what's the next day going to be like? How am I going to handle this situation or that situation? So even if it's just to have a 5-minute call to calm you down of your worries and anxieties, it was well worth the times that I called them. So, but you don't have to be in the throes of a crisis to call it for any reason. If you need information about this disease and how to handle it, that's what it's for. Next is our online website, alz.org, which is often the first stop for individuals following a diagnosis of Alzheimer's or another dementia. And this includes sections specifically for people living with the disease and caregivers. Let's listen to Teresa here and her experience.
When I went to the Alzheimer's Association website, which is alz.org, there I was trying to find out more about what was Alzheimer's, what really is this disease, what is younger onset Alzheimer's, what is dementia, is there a cure? How long has this been around? How many people are affected by this? Where can I go for resources? Where can I go for help? What do I do with this? How can I handle this? Is there more people like me out there? Is there someone that I can talk to if I need to? And there I found the support line that's 24 hours a day. And there I found where I can go for workshops, where I can go and read things and postings that people have done, where I can find out what events is happening in the Alzheimer's Association, where I can see how it's affecting people around the globe.
And lastly, on this slide, we have our Alzheimer's Association and AARP Community Resource Finder. This is a wealth of community-based resources available in your area, including long-term care and community-based services, local association offices and their offerings of programs and support services. Let's see what Tom had his experience with this.
Since I've been diagnosed with dementia, the one place that I know I can go to for assistance and help and support is to the Alzheimer's Association. There are people there that I know by name that I can contact if I'm having a difficult time or if I'm struggling to find some resource, that they will provide that to me.
So that concludes the body of our program today. I'm going to put up the last slide here for a few seconds to again have that 800 helpline phone number available and our website available. But at this point, I'm going to ask Lauren Hibdon to join me again, and we're going to talk a little bit about the effective communication tips for, especially for those that are helping caregiving with someone with Alzheimer's. So Lauren, I'm going to stop sharing my screen.
Okay, sounds good. Thank you, Jean, for that presentation. I think you did a wonderful job of kind of covering the basics of Alzheimer's and all of the related dementias. And I think what makes you such a powerful presenter is you weaving in your personal story and knowing that you went through this and you came back to volunteer with us after your journey of being a caregiver. So talking about kind of effective communication tips, as the brain changes with Alzheimer's disease progression and people lose the ability to speak and decode language in their normal, usual way. And the better that one understands the changes, the better that we can connect with the person and with Alzheimer's or another dementia throughout the course of the disease process. And communication is a way to express who we are, how we relate to one another, and it's much more than just talking and listening. It's about sending and receiving messages through our attitude, our tone of voice, our facial expressions, and our body language. And as Alzheimer's disease or related dementia progress, people lose their ability to communicate their thoughts and their feelings through their words. They also might lose the ability to understand the words that others are speaking to them. However, they do still maintain a sense of self throughout the disease process. So kind of if we were going to give some communication tips and starting in the early stage of the disease process on that continuum that you showed, Jean, what type of changes would someone see in the early stages of Alzheimer's?
Thanks, Lauren. In the early stage, you may or may not see changes in the way the person communicates. For some people, there may be some shifts in their ease with words or conversations. Some of the most common changes you may notice include difficulty finding the right words, taking longer to speak or respond, withdrawing from conversations, struggling with decision-making or problem-solving, and reacting more emotionally than in the past, or avoiding discussion of the disease and its impact.
And Jean, what are some of the ways that a loved one, a family member, a care partner could connect with someone who's in the early stage of Alzheimer's or another dementia?
Well, one of the best ways, Lauren, is to be sure you are offering the help with communication that the person needs, is to ask directly of that person. For example, if a person struggles to find the right word, ask the person if they would like for you to help supply the word or to wait patiently. Now, in my experience, because Art was okay with discussing his diagnosis, he was not embarrassed or unwilling to share that, we were able to have a good conversation about this very fact. And for him, he wanted my help. If he noticed that he was struggling, he would ask me, or he would allow me to go ahead and fill in the blanks for him. But that's not true for everybody. So again, asking. Some other tips: keep your sentences direct and straightforward to help the person avoid feeling lost in the conversation. And this is real important. Allow extra time for conversations. You can't be rushed when you're communicating or connecting with that person. Speak directly to the person if you want to know how he or she is doing. Sometimes, you'll go into the doctor's office with your partner, the person who has the disease, you attend their exams directly, and sometimes the doctor will put all their questions to you, the caregiver, or to the person attending with them. And that can be very frustrating for the person, especially in the early stage, because they're usually pretty aware of what's going on with their condition, and they want to be treated as the adult that they are. So speak directly. And it's okay to laugh. Sometimes humor lightens the mood and makes communication easier. I know Art had a great sense of humor, so that was easy for me to allow a little humor to occur. And when he would say something funny, even if it wasn't on point, I would go along with it. So most importantly, don't pull away, Your friendship and support are important to that person.
Thank you, Jean. So if we were then kind of shifting into the middle stage as the disease is progressing, what are some of the changes that affect communication in Alzheimer's as we move into that middle stage?
Well, if you notice some changes in communication in the early stage, they are likely to become more pronounced in the middle stage. And some of these changes may include increased difficulty finding the right words, using familiar words repeatedly, inventing new words to describe familiar things. For example, a wristwatch may become a hand clock because they can't come up with that terminology wristwatch. The next best thing that enters their mind may be a descriptive term like hand clock. They may easily begin losing their train of thought, speaking less often and becoming more quiet, communication through behavior rather than words more often. And that's quite common, where people will act out certain emotions rather than because they can't communicate what it is they want to express. And please note that some physical conditions and medications can affect a person's ability to communicate, and that you may want to address with the primary care doctor. But again, in my case, in my experience, Art became more and more he was a very social person and a very easily conversant person, but in the middle stage, he would often decline invitations to join friends or family because he felt like he could not keep up with conversations, or the noise level in a group of people became very distracting. So he began to withdraw more and more from those kinds of situations. And that was quite frustrating because that altered our lifestyle significantly.
And do you have any tips for the caregivers among us, or the loved ones among us in the middle stage, on how to connect to someone with Alzheimer's?
Sure, thanks. That's a good question. First, approach the person gently. Identify yourself and approach the person from the front and at eye level. This will help orient the person and get his or her attention. I can't remember the context, but if anybody saw the Oscar show last week, they said that Lady Gaga was especially sensitive when she came onto the stage with Liza Minnelli, and she treated her with a great amount of dignity and compassion and patience in the way she lowered her presence to look at Liza with eye level and that sort of thing. So very important, those kinds of tips. Also, sometimes using touch can show that you care, even when your words are just about a task or are not understood. A gentle touch can also help get a person's attention. Responding to emotions behind the behavior or concern. And once responding to the emotions, reassure and redirect the person by encouraging him or her to do something that may shift the person's thinking or behavior. You could say, for example, "I'm glad to be here with you today. Let's go for a walk outside." Again, changing the subject matter or diverting that will make them feel better. And tone of voice, be calm and patient. And that for me was very difficult. I tend not to be a patient person, but maybe it's one of the silver linings of being a caregiver, is I learned very quickly that patience was my friend, and it alleviated a lot of frustrations with Art. Take time to communicate and use short sentences, basic words, and speak clearly. And by all means, don't criticize, correct, or impose your perspective. It will backfire most of the time. You need to join the person's reality, meaning taking time to see the world as he or she may be seeing it right at that moment.
Do you have an example of that, of kind of how do you join someone's reality if what they're saying isn't matching up with your reality?
Yeah, that was one of the most difficult things for me to change about myself. But I realized after a few failed attempts that I needed to enter Art's reality. For example, he often would ask about his mom and dad, who had passed away many years before, certainly before he developed his Alzheimer's disease. And the first time he asked that, I was too honest. I reminded him that they were no longer alive, and that was very upsetting. And I quickly was able to change the subject to get so that he would not dwell on that. But he repeated that often. Have you talked to mom and dad? Have you talked to my mom and dad back in New Jersey? And I had to enter his reality and realize that that was a much more compassionate way to relate to him. And it made our connection real for him. You know, when it's a spouse, as it was in my situation, it's especially difficult when you know that your role has changed in the eyes of the person with the disease, because I was no longer his loved one husband. I'm not exactly sure, but he knew that I was his caregiver, or that I was there for him. But I had to make sure that I treated our relationship in a way that was very difficult for me. Let's face it, he's there living, breathing as the person that I had spent 30 some years with. And but I realized I had to shift into his reality and not be that person that I once was to him. So I guess those are a few examples of how you have to join the person's reality.
Those are great examples, Jean. It kind of, I think it kind of drives the point home. Absolutely. I did see someone mention in the chat, are we talking about Alzheimer's specifically or dementia as a whole? And I think we've been using the words a little interchangeably, but we are referring to Alzheimer's. These communication tips apply for Alzheimer's. They also apply for any related dementia as well. These are just good communication tips as the disease progresses, because that ability to use language shifts with any of the forms of dementia. So kind of now talking about the late stage, Jean, what would someone see in terms of what are the changes that you see in the late stage?
Sure. So in the late stage, the person may only use a few words, but he or she still needs to connect and communicate. And that word connection is really critical. Since the person has lost many functions by the late stage, you may feel a strong urge to do something. Usually, your presence and connection with the person are much more important than doing something specific for that person. Remember, the person is an adult with a sense of self that continues throughout the stages.
And Jean, do you have any suggestions for how to connect with someone who's in the late stage and might not have the verbal ability?
Yes, using familiar words, names, phrases, favorite poems or readings, passages, songs, things like that are helpful. Whether you get a direct response from the person or not, the sound of your voice helps maintain that connection between you. Also, using the 5 senses is a great way to connect in the late stage through touch, sight, sound, smell, and taste. And some examples of that. For touch, hand massages with lotion, or feeling different fabrics and textures. Stroking the person's hand, arm, or back is helpful. Using the sense of sight, you can laminate brightly colored pictures to look at together, or watch videos of animals, nature, travel, things like that. Looking at photo albums together, painting with watercolors, or just going outside to absorb some of the nature, or even by an open window just to gaze out at what's going on outside. All of that can be helpful. And again, it's that connection between you that is really matters. For sound, we find that familiar music is a really helpful tool. Reading, I know in Art's last days, I did a lot of reading to him, and it just was a very calming time of the day when we would do that. And I would read things that I knew he liked. For example, history was one of his favorite subjects. So even though he may not have followed all of the words, I think just the idea that it was my voice and being together. Now, you can use a sense of smell by, connecting with this person by allowing them to smell different fragrances or things that they're not allergic to, certainly, but you can use essential oils or candles that have scents to them, or certain foods or things from the garden. And then finally, for taste, generally that sense of taste is still a very favorite sensation for all of us as we age. So allowing them to have their favorite foods, and it's not the time to restrict, things that may not be the healthiest foods. If they want something sweet, that's okay too. So those are all good ways, using all of the senses to connect with the person.
Wonderful. Thank you so much, Jean. I think that was really helpful. And so in summary, communication evolves throughout the stages of Alzheimer's, and adapting to those changes requires commitment. I think Jean would agree there as a former family caregiver. But by adjusting your communication as the disease progresses, you can learn to connect deeply and meaningfully, enhancing your relationship with each other. It's definitely a time for personal growth for the caregiver. Someone, Jean is not the first one to say, I wasn't a patient person before I became a family caregiver for someone with dementia. But I just want to emphasize that caring for yourself while you care for someone else can have an effect on both you and the person with the disease. You can provide better care for the person with dementia if you are well rested and taking care of your physical and emotional needs. It's not always easy to kind of identify what we ourselves need as a caregiver for self-care. So if you're having trouble balancing your caregiving responsibilities and your own self-care, please reach out to the Alzheimer's Association, and we can offer some solutions and some guidance and resources to help assist you in your caregiving journey. So our 24/7 helpline number is 800-272-3900. And I think now we're going to take some questions.
Well, first, I would like to thank you so much. I mean, what a information-packed presentation, and I'm certain that many of us in the audience have this, feeling of gratefulness that you're doing what you're doing and sharing with us. And Jean, I just want to put my arms through the screen and give you a big hug. Thank you so much. It was really an amazing time flew, an amazing hour. And so, yes, we do have some questions. So let me pop those up. Okay, so Jean, this question is directed to you, and the question is from Kate, and she says, as a former caregiver, any advice for new caregivers who are just starting on their caregiving journey?
Thank you, Kate. That's a great question. And my response to that is to not wait to ask for help, whether it's through your own network of family and friends, or your medical community, or especially the Alzheimer's Association. Help is available. You can't do it all by yourself. You'll wear yourself out. And it's just, you need some downtime for yourself so that you can stay healthy. So that's my biggest tip, is to ask for help. Don't be afraid to ask for help. People are willing to help if you ask. And take it one day at a time. Don't try and accomplish everything at once, because it's an evolving and progressive disease that will change how you approach the person.
Great. Thank you so much. And Judy asks, please repeat the participation studies.
I'm not, say that, I'm not sure I understand the question.
I think when in your slide deck, you talked about the participation. You know what we
trials?
Trial match, I think.
Yes, yes.
Yes. That is a way for, if you're interested in participating in many different studies on many different aspects of dementia and Alzheimer's, the Alzheimer's Association has a real helpful tool called Trial Match to help you identify what study might be best for you to participate in. There's various ways of participation, lengths of time, and so forth. So I would encourage you to go to our website and look up Trial Match and get started that way.
Wonderful, thank you. And then Anne is asking if we're concerned about a relative who has not been formally diagnosed yet, but has symptoms like aphasia, where do you recommend we start? Meet with the GP?
It's really important to get the diagnosis because it may or may not be what you think it is. So it's helpful to seek medical advice. Generally speaking, we always get to our primary care doctor first. If you don't feel you're getting through to your primary care doctor, you can always ask to see, and you would often find that your doctor would refer you to a qualified neurologist or someone with a specialty in geriatrics to help with that diagnosis. So it's real critical to find out what exactly is going on. Sometimes medications or sometimes other diagnoses can mimic the same types of symptoms that one might experience with a form of dementia. So it's real important to start with that. Now, not everybody wants to, admit that they might have such a disease, and there may be some resistance in getting a diagnosis, or people think, well, it's a one-way diagnosis anyway. I can't do anything about it, but it really helps the planning process. It helps if new medications come out, you can be first to know about it and so forth. So getting that diagnosis is the critical first step.
Right, thank you. Thank you. And kind of a bit of a follow-up to that is if you have any highlights on Parkinson's disease dementia or anything you can mention about that.
I may lean on Lauren here. I'm not a medical expert, so I can't really address the specifics of Parkinson's. It is a form of dementia, as you saw on the one slide. Lauren, is there anything you can add on?
Yeah, I'm not sure exactly what information the person's looking for, but oftentimes Parkinson's, if someone can be diagnosed with Parkinson's disease for many years, and then later on develop cognitive impairment, and so they call that Parkinson's disease with dementia or Parkinson's disease dementia. If you are experiencing some things that look Parkinsonian, look like maybe some changes in mobility, possible like changes in wakefulness, as well as cognitive impairment kind of occurring at the same time, they might look in toward the dementia with Lewy bodies, because all of these under the umbrella can have similarities. So it's really important to kind of go to the doctor, find out what you're dealing with, because they're not all treated the same, and they don't all express themselves the same way. Hopefully that's helpful.
Thank you so much. Another question, kind of a statement in question, is getting a diagnosis is one thing, acceptance is another. What if someone is in denial regarding their diagnosis?
Well, sometimes, if you are their primary go-to person, it may be helpful to bring other individuals in, whether it be medical people or friends or family that might help explain, what the diagnosis means or what future considerations would need to be discussed with the person. That's a challenge. Not everybody is in the acceptance stage, and they may never be. But there are medical professionals in the psychological or psychiatric arena who may be able to do some counseling, or just therapists who may be able to help a person cope with a new diagnosis like that. So I don't, again, Lauren, if you have anything to add on that question.
Yeah, I think, they say about 50% of those with a dementia diagnosis really understand that they have a diagnosis or even the level of their impairment. So it's not unheard of that there might be some resistance or some denial, not accepting the diagnosis. And so sometimes for the caregiver, it's more around how do I, navigate this care. It doesn't really matter if they are ever going to say, yes, I have X, Y, and Z. The diagnosis, they don't necessarily need to be, mentioning that, but it's still getting yourself support and kind of, what you're dealing with. So how do you educate yourself around the disease process and make yourself a better family caregiver for that person?
Great. And then this is, kind of along the same lines, a family member whose spouse is in denial that she is changing. She is less and less able to function. Most recently, didn't know how to open a car door. She's anxious, resentful, and if she thinks someone is talking about her, advice for them, for the family, for friends, all that are concerned about this patient and the caregiver.
Yeah, that's a real challenge. I understand that. And again, to have additional friends, family members who are there to add some perspective, maybe some are better at communicating on that level with the person. It's everybody is different, and you just have to exercise a lot of patience in dealing with those situations. Again, I think some professional help is often a good route to take, but that's not always possible either. So I'm sort of struggling on this answer, as you might be able to tell, because
let me jump in a little bit, Jean. So right now, the process to get a diagnosis of any form of dementia is a rule out. And so they have to figure out what could possibly be causing these symptoms and until they get to this diagnosis. So sometimes to get the person into the doctor, it's more focusing on all the things that are getting ruled out. So, I've been noticing some changes in you. Are you depressed? Has there been any changes, in your thyroid, or, how about your hearing or your vision? Kind of getting them in through the door can sometimes then help to lead that conversation if you have a, kind of a skilled doctor. And I think the Alzheimer's Association has what we call the 10 warning signs presentation, and it talks about what to look for and then how to prepare for that doctor's visit. And we have a handout that kind of talks about the different warning signs and then what you are noticing in each area. So you could give that to the doctor, or the family friends could give that to the doctor ahead of time, knowing that the doctor wouldn't be able to speak openly with you, but it might help to guide the conversation, and that the doctor would know that there's some resistance there around getting a diagnosis.
Great, thank you. Another question that just popped up is, if you have had a stroke, are you more likely to develop the disease?
Well, as a matter of fact, the term vascular dementia is often related to that kind of a situation where someone has had a stroke, or at least has some form of a dysfunction in the brain, whether it's bleeding or blockage, that sort of thing that causes stroke, or having mini strokes or PIAs. PIAs, thank you.
Mm-hmm.
So it is another form of dementia. In fact, Art, my husband, had both Alzheimer's disease and vascular dementia because of some blood pressure issues probably that caused that vascular breakdown. So that is not exactly the same as Alzheimer's dementia, because it's usually a different part of the brain and the underlying biology is different, whereas Alzheimer's has the buildup of the amyloids and plaques and so forth. Vascular is just more of a breakdown or blockage in the vascular system.
Great. So this is going to be our last question, and I do regret that we don't have more time, but we are inching past 2 o'clock. But this is a good question. I think we can end the Q&A on this one. Can you talk about bringing a non-family person into your home to help being a caregiver, and how is the awkwardness of that dealt with?
Yeah, I actually did. I was still working at a pretty demanding job when Art was diagnosed and progressing through into the middle stage. So we did have to hire a caregiver for an increasing number of hours. And we were fortunate to have a caregiver who was the same caregiver every time or every day that he came in. Occasionally there would have to be a substitute for various reasons, but so that was an advantage. But you know, I know that a lot of people just don't want anyone else in their home, and I think it's helpful just to try for a very short period of time. If you don't find someone that's compatible, then work at it until you do find someone compatible. If you're lucky enough to have a known friend or family member who can do some of that, or if you can fill in with several people, that makes it a little bit more compatible for the person with the disease, because there's some recognition there. But I know Art struggled with certain elements of having someone in the house, especially in the earlier days of that, where they would have to negotiate who did what. But I think you need that help oftentimes, and if you can go through the process of eliminating those that don't work and find the one that does, I guess that's the best thing to do. I don't know if Lauren has any other.
Yeah, one of the very first questions we had was something about the journey of this, and that's just all part of the journey, isn't it? It just is. Wow.
I would just recommend, since I know that I'm seeing other questions and we don't have the time to answer them, you can call our helpline anytime, 24/7, and you can talk to someone who's a master's level clinician who really understands dementia and caregiving, and you can ask any question of them, and really at any point. So yeah, just wanted to do a little plug there for that, because I know I'm seeing a bunch of questions that we're not going to get to.
And I want to take this opportunity just to thank you again, both of you, for all of the information, and to remind everyone, this is a nonprofit organization, and all volunteering and donations are more than welcomed. And so we encourage you to help participate in this work that's being done, because I would imagine most of us on this call has had a loved one that we've have lost to Alzheimer's or some type of dementia. So thank you so much for your compassion and care, and for taking care of everyone as you do. Thank you both for joining us, and we look forward to having you back again. Obviously people really enjoyed hearing what you had to say, so thank you so much.
Thank you for the opportunity. It's a pleasure.
Great, thanks. And I want to thank all of you participants for joining us today. This was really so informational, so moving, so, for me anyway, just reassuring that we have such an amazing organization right here in our neighborhood to give us the support and answer our questions. And before we say goodbye, though, I do want to inform you that Thursday, May 5th, is the last webinar of the year, which I don't know about all of you, but I cannot believe we are already at the last webinar of the year. Time has gone by quickly. So this particular webinar is called Peace Building on the Front Lines, the Search for Common Ground. The webinar will feature Jacqueline Oburu, who will interview Judy Kamano. Judy is the director of the African community-based nonprofit organization Common Ground. Ms. Kamano helped restore Kenya's economy when she led a group of activists posing as local fishermen. Ms. Kamano worked with the local fishermen and the Kenya government to stop the ban on nighttime fishing and thus restored the local economy balance in the country, which is amazing, right? You can sign up for this and all future public webinars by going to the Outdoor Art Club's website and clicking on public events. So thank you all once again. Have a lovely afternoon, and don't forget to sign up for the Search for Common Ground. I think it's going to be amazing and quite a story. Take care all. Thank you.